Welcome to the HIPAA Security Training Chapter 1. In this course, you will learn about the Health Insurance Portability and Accountability Act, also known as the HIPAA Security Rule. In this course, we will delve deeper into the HIPAA Security Rule and cover safeguards required to protect the security of protected health information in electronic form. Our course objectives are to learn the purpose of HIPAA Security Rule, understand the key elements of HIPAA Security Rule, understand which entities HIPAA Security Rule applies to, understand the meaning of Electronic Protected Health Information, also known as the EPHI, understand the value of the security rule related to HIPAA, learn the penalty structure associated with the security rule, understand the impact of the HIPAA Security Rule on your business. So what is HIPAA? The Health Insurance Portability and Accountability Act, also known as HIPAA, is a monumental piece of legislation that was introduced in 1996 to simplify healthcare administration, prevent fraud in healthcare, mitigate wastage, and ensure that employees could maintain healthcare coverage when they're switching jobs or are dismissed. It covers how healthcare providers and business associates should handle patient-sensitive data and protect their health information, and sets the benchmark that is needed to ensure protected health information, also known as PHI, is being stored, handled, and accessed correctly at all times. When people say patient information, it generally means protected health information or electronic protected health information. Anatomy of the HIPAA regulations. The HIPAA regulations can be broken down into 5 major titles and provisions whose purpose logically fall under 2 major categories: administrative simplification and insurance reform. For healthcare providers, the administrative simplification part is more significant, and the insurance reform part is more significant to insurance providers or payers. Generally, when we talk about HIPAA, they refer to the administrative simplification section, as you can see in the image below. HIPAA at present. HIPAA is now best known for protecting the privacy and health information of the patients. While there are various aspects to HIPAA, today when people talk about HIPAA, they are generally referring to the HIPAA Privacy Rule and the HIPAA Security Rule. The HIPAA Privacy Rule requires organizations to protect the privacy of protected health information and limit the use and disclosure of information that may be used without the patient's consent. For example, policies and procedures, workforce training, business associate agreements, etc. The HIPAA Security Rule requirements are an extension to the protections contained in the Privacy Rule, which address non-technical and technical safeguards that providers must implement to ensure the security of electronic health information. The examples can be password policies, firewalls, encryptions, and antiviruses. HIPAA timeline. Since the passage of HIPAA, there have been notable changes to the law, and these changes were included in the federal stimulus bill known as the American Recovery and Reinvestment Act of 2009. Those updates are referred to as the Health Information Technology for Economic and Clinical Health Act. Anticipating the number of exchanges of EPHI to skyrocket, the HITECH Act expanded the scope of privacy and security safeguards available under HIPAA, in addition to allowing more strict reimbursements and increased penalties for non-compliance. Essentially, the Omnibus Rule incorporated the HITECH Act back into the HIPAA regulations in 2013 and provided more detailed guidelines. The current scenario. At present, the healthcare industry is falling behind in terms of security implementations for information, critically risking the privacy and security of public health information. As the image shows, 95% of healthcare organizations have internet connectivity. 71% provide internal system-wide computerized patient information. 65% intend to incorporate web applications. Only 24% carry out security awareness programs, and 25% have no firewalls whatsoever. In the images below, you can see the HIPAA breach on the newspaper on multiple events. What is the HIPAA Security Rule? The HIPAA Security Rule requirements ensure that both covered entities and business associates protect patients' electronically stored protected health information through appropriate physical, technical, and administrative safeguards to fortify the confidentiality, integrity, and availability of ePHI. To be more precise, the HIPAA security rule is a federally mandated benchmark for protection, expandable from small practices as minimum as one-person organization to large organizations with hundreds to thousands of members. Broad, unbiased towards particular technology, does not specify or recommend any particular technology to be used. Who must comply with the security rule? Any entity or person that stores or transmits ePHI. This includes both covered entities and business associates. Covered entities are those who create or generate PHI in the first place and are in direct relationship with individuals whose PHI is being kept, for example, hospitals or dentists. Business associates are those who receive PHI from a covered entity or another business associate. At present, with the ubiquitous use of computers, the most organizations will need to implement security safeguards. The only organizations that don't need to apply the safeguards are those who only store PHI in papers and do not utilize computer systems or store or transmit PHI in electronic format. HIPAA Security Rules Objectives. The main purpose of the security rule includes ensuring the confidentiality, integrity, and availability of all ePHI that an organization creates, receives, maintains, or transmits, protecting against valid anticipated hazards to the security or integrity of ePHI, such as earthquakes, storms, fires, and so on, protecting against unauthorized use or disclosure of ePHI, ensuring compliance by the organization's workforce. Flexibility in the security rule. The security rule was designed to be flexible and scalable so that the covered entities and business associates can implement policies, procedures, and technologies that are appropriate according to their size, structure, and daily operations. To break it down, it allows organizations to take the following into account: size, complexities, and capabilities, technical infrastructure, hardware, and software security aptitudes, the costs of security safeguards, the probability and criticality of potential risks to ePHI, how ePHI is being accessed and used. General structure and requirements. The HIPAA security rule can be broken down into three categories: administrative safeguards, physical safeguards, and technical safeguards. The administrative safeguards are the policies and procedures that were developed and outlines how the organizations will comply with the security rule. Physical safeguards are managing physical access to protect against unauthorized access to protected information. Technical safeguards are managing access to computer systems and protecting communications transmitted electronically over open networks. General structure and requirements. The three safeguards contain 18 standards in total, 12 of which have implementation specifications, 6 of which do not. Administrative safeguards have 9 standards, physical safeguards have 4 standards, and technical safeguards have 5 standards. If you take a closer look, the security rule can be structured as a tree going from the top to bottom. A standard outlines what an organization must do. Implementation specifications tells us how to do it. Head on to the next slide and you will see a few blocks at the bottom with the sun on top of it. You are required to focus on the sun, which are implementation specifications. The safeguards and standards are primarily there for the purpose of structure and grouping. Administrative safeguards. The administrative safeguards under the HIPAA security rule involve developing and implementing processes, policies, and procedures that will work best in protecting against unwanted breach and unwanted disclosure of sensitive health information. The administrative safeguards consist of the following 9 standards: security management process, assigned security responsibility, workforce security, information access management, security awareness and training, security incident procedures, contingency plan, evaluation, and business associate contracts. Physical safeguards. Physical safeguards involve implementing measures that protect the physical security of facilities where ePHI may be stored or maintained. Some common examples include alarm systems, surveillance cameras, restricting areas where ePHI is stored. Physical safeguards and control measures must include these 4 standards: facility access controls, workstation use, workstation security, device and media controls. Technical safeguards. By definition, technical safeguards are technology and policies that protect electronic health information and control access to it. Examples of technical safeguards include firewalls, data backup, encryption of devices. Technical safeguards consist of the following 5 standards: access control, audit controls, integrity, person or entity authentication, and transmission security. Required versus addressable. Each of the HIPAA security rule implementation specifications describes how standards should be executed, but they are categorized as either required or addressable. Required means the rules that must be implemented by the organization. Addressable ones gives the flexibility to the organization to determine whether the addressable implementation specification is reasonable and appropriate for their practice. Specification: reasonable and appropriate. This must be implemented. Specification: not reasonable but appropriate. In this case, there are 2 options. Implement an equivalent alternative that fulfills the same objectives as the addressable implementation specification. Describe and fully document how the overall standard can be met, even if it is not either implemented or a different method has been used, or this has been implemented as a partial solution. It is to be noted that contrary to what most people assume, addressable does not necessarily mean optional. Let's do a case study on the HIPAA security rule. Jack is quitting his job, and it's his last day at the clinic. Out of curiosity, Jack got into his former computer system at the clinic, and to his surprise, his password still worked. Just before leaving the building, he decided to download all the names of the patients and copied them into his flash drive. The flash drive was somehow stolen and the information inside got leaked. What could have been done to prevent this breach of patients' information? There should have been a set of stringent policies and procedures in place that includes immediately terminating all employee access for an individual who no longer works at the clinic. Let's do another case study on the HIPAA security rule. Jill from the accounting department stepped away from her desk to use the restroom. Jack, Jill's friend, stopped by her desk to ask her if she wanted a coffee and noticed that his neighbor's billing record is on the computer screen. Jack was shocked to discover that his neighbor Adam was a cancer patient. How could Jill have better protected Adam's privacy? Standard security policies and procedures should have been already in place outlining that all PHI should be protected from accidental disclosures. In this case, Jill should have locked her computer screen or put on a screensaver and put away all patient records in a secure location before leaving her desk. In addition, policies should also include restricting entry for non-employees to the sensitive areas. Let's do one more case study on the HIPAA security rule. A small dentist's office had all their medical records stored on their computer systems. One day, a malicious virus infected one of the computers, and it quickly spread out across the other computers on the network. Unfortunately, all the data on the computers were wiped out, and it was unrecoverable. Making matters worse, they did not do any backups, so all the information had been effectively lost since they started their practice. What could the dentist's office have done differently? The dentist's office could have had the latest antivirus software installed on each computer. They could have documented policies and procedures to handle similar common security incidents should already be in place. They could have performed regular backups of the critical data. HIPAA breach, improper uses, and disclosures. When PHI is inappropriately used or disclosed, it is considered as a HIPAA breach. A breach is defined in HIPAA Section 164, Clause 402 as the acquisition, access, use, or disclosure of protected health information in a manner not permitted which compromises the security or privacy of the protected health information. Unless the covered entity or business associate demonstrates that there is a low probability that the PHI has been compromised based on a risk assessment of at least the following factors: the nature and extent of the PHI involved, including the types of identifiers and the likelihood of re-identification, the unauthorized person who used the PHI or to whom the disclosure was made, whether the PHI was actually acquired or viewed, and the extent to which the risk to the PHI has been mitigated. In the event of a breach, both covered entities as well as the business associates are required to immediately investigate the breach, mitigate it, document it, and then notify the affected individuals as well as the Office for Civil Rights at the Department of Health and Human Services. If a breach occurs at any of the business associates' site, then the covered entity is also responsible for notification on behalf of the business associate. Examples are given below. Records faxed or mailed to the wrong person. Sharing PHI online or via social media without permission. Insufficient ePHI access controls, allowing an unauthorized individual to access PHI through computer systems or credentials. Loss, damage, or theft of devices, media, and equipments, or paper containing PHI. Let's do another case study on HIPAA breach. Michael works for a home health agency. On the way to visit one of his patients, he decided to stop by a small cafe to grab a quick bite. Expecting it would be just a few minutes, he left his laptop on the back seat. When he returned, he noticed that his laptop was missing. What should Michael do? Michael should immediately contact and notify his agency's compliance officer. In addition, Michael should ask the cafe if they could provide any CCTV footage or if anyone around had seen anything. If the laptop's hard drive had been encrypted, then breach notification would not be required. However, if it wasn't encrypted, it will require the organization's compliance officer to follow the breach notification protocol outlined under HIPAA and notify all affected individuals as well as the HHS depending on the size of the breach. As far as the prevention goes, Michael should have made sure that the laptop wasn't publicly visited, or if possible, he could have carried the laptop with him in a backpack. The agency should have encrypted all the laptops containing PHI to handle situations like this and could have avoided having to convey the breach notification to the patients. Complying with the security rule. Implementing these 3 steps in your practice could ensure the compliance with the security rule. The company could assign an individual who will be responsible for implementing and overseeing HIPAA security compliance at the organization. This person can be the compliance officer. Identify gaps and fix. Conduct a risk assessment to corroborate your facility's technical infrastructure and security safeguards against the HIPAA security standards to identify the gaps or vulnerabilities and remediate them. This entire process should be performed at least once a year. Formal documentation and controls. If you have access or maintain ePHI, make formal documents and implement controls to protect the information. This includes developing policies and procedures and documents required as per the HIPAA security standards. Penalties for non-compliance. Non-compliance is a civil offense and penalties are based on the level of negligence and can range from $100 to $50,000 per violation, with a maximum penalty of $1.5 million per year for violations of an identical provision. Criminal offenses constitutes unauthorized disclosure or misuse of PHI under false pretenses or with an intent to sell, transfer, or use PHI for personal gains or malicious harms. The fines can be anywhere between $50,000 and 1 year in jail to up to $250,000 and 10 years in jail. Civil penalties are enforced by the Office of Civil Rights within the Department of Health and Human Services. Criminal penalties are enforced by the Department of Justice. It is to be noted that penalties do not only apply to individual violators. They may also be applicable to the organizations or even its officers. You've successfully reached the end of Chapter 1. Congratulations! In the upcoming chapters, you'll be learning administrative safeguards, physical safeguards, technical safeguards, and becoming HIPAA security compliant.